to us as a country. Botswana is grateful for the continued support of the World Organization of Animal Health, including the review of the veterinary legislation and performance evaluation of our veterinary services, which was done in 2010 and 2019 respectively. As government considers the World Organization of Animal Health as an important partner, not merely a donor of vaccines or provider of technical support. The standards are important tools for trade, at the same time guide our animal health policies and programs to protect our livestock industry. The World Organization of Animal Health recently endorsed Botswana's official control program for foot and mouth disease, and as a ministry and country, we're delighted to have received that endorsement. There's no better validation than this that speaks to the quality of our veterinary services countrywide. My ministry is committed to implementing the progressive control pathway for FMD in order to ultimately expand our free zones and unlock the value chains of our livestock industry, especially in the northern part of the country, such as in the Ngamiland district. I understand Namibia is the only country in Africa with the World Organization of Animal Health and those official control programs for rabies. As a country, we intend to follow suit and have our own control program endorsed also. Ladies and gentlemen, together, collaborating with the World Organization of Animal Health, World Health Organization, WHO, Food and Agriculture Organization, FAO, to prioritize rabies under the One Health approach and have launched the United Against Rabies. As a country, we also subscribe to controlling the rabies disease and have a reasonable control program based on awareness, raising, and vaccination. The One Health strategy cannot be overemphasized. Our being here together with the Ministry of Health is a testament of this strategy and that it works and it can work if we all club together. To this end, the government through the Ministry of Health has committed to establishing a public health institute which will oversee the One Health coordination of public health risks, including zoonotic diseases such as rabies and antimicrobial resistance. My ministry is intensifying public awareness in order to increase uptake of key messages about rabies. This is because we have observed a decline in the number of vaccinated dogs and cats from 210,518 in the year 2019-2020 to 187,856 in 2020-2021. With the current vaccination campaign going on, we have so far vaccinated 97,140 dogs and cats. I therefore wish to encourage all farmers, all stakeholders, wherever they are, to take their dogs and cats for vaccination before the 31st August 2022. As I said earlier, on the One Health strategy, I would want to, without digressing, underscore the fact that we need to club together with the Ministry of Health in also fighting what we normally call which is one aspect that, or ailment, that our farmers out there are grappling with when they sell their animals to slaughter the houses or abattoirs, even the BMC. That is one of those that are troubling us, and it is through the collaboration that we can forge with the Ministry of Health that we can eradicate this scourge. As I conclude my remarks, Director of Ceremonies, allow me to once again thank most sincerely the World Organization of Animal Health for the 50,000 doses of rabies vaccine, which will cover 50,000 more animals. This is by no measure a small gesture for yourself. We are eternally grateful, and we hope to continue to forge more strategic and better ways in which to collaborate with yourselves so that we can continue to improve our livestock industry. Make use of your resources, make use of your being here in our country so that our livestock industry takes its rightful space in its contribution to the GDP of this country and wealth for Botswana or high. Thank you very much once more, Director of Ceremony.
Health platform, and I want to repeat One Health platform. And I'm very, very happy that today we have WHO here, we have FAO here, and the Ministry of Health here, because this is what One Health is about. One Health is about combining all the health, the animal health, the human health, and the environment also. Unfortunately, we don't have a net office in Botswana, but hopefully one day we'll have, because animals and humans, we live in the environment, and all this influence disease patterns. So for us, this is a very big deal, and we have really crafted this way forward that we're going to deal with all these diseases as one health. Director Solomon's mass dog vaccination is the most, I'm not going to talk about the epidemiology and pathogenesis of rabies. We've already heard it from the activities, what causes rabies, how it's transmitted. And same ways we reiterate here. And we want to say that mass dog vaccination is the most practical and cost-effective method to interrupt the disease infectious cycle between animals and humans. It is estimated that by vaccinating 70% of dogs, rabies could be eradicated in dogs, and the number of human cases would rapidly drop. And there are good rabies vaccines available. So what we are trying to say here is that amongst all control efforts, vaccination of dogs is the most important way of tackling rabies. Even at the human interface, because the less dogs are sick, we heard that this disease is transmitted through bite from infected dogs. If we can vaccinate these dogs, their bites will no longer be that harmful. And Director Samuels, I want to say that it is pleasing to know that here in Botswana, the government has for decades vaccinated dogs and cats annually against rabies, and that consequently the country has a relatively low prevalence of the disease in humans and animals in Africa. I might be standing to be corrected there, but as far as I know, for a long time, Botswana has a very low number of cases of rabies in animals, but maybe the situation has changed. We further encourage Botswana to apply for endorsement of its rabies control program by the World Organization for Animal Health, as this will motivate the country towards the achievement of freedom from dog-related rabies by 2030. And also it might attract potential donors who will help the country. This is a process, this endorsement is a process that is done by the OIE, so that whatever you are saying or you are putting forward as a control program for rabies is now international and is recognized internationally as such. Honourable Minister, ladies and gentlemen, in 2015, the international community agreed unanimously to eliminate dog-related rabies in humans by the year 2030. This will require every country and every international agency involved in rabies control to scale up their rabies control efforts. Whatever we've been doing, we have to now take it to the next level. As for the quadripartite, that is WHO, FAO, UNEP, and the OIE, rabies is prioritized as a One Health disease which the 4 organizations pledged to tackle jointly. Furthermore, the World Organization for Animal developed a rabies vaccine bank, which delivers highly efficacious rabies vaccines to member countries. Since its establishment, it has delivered millions of vaccine doses to many countries, mainly in Africa and Asia. As you heard earlier, these are the continents which are mostly affected. In recent times, that is since 2019, for the SADC countries, about 1 million doses of rabies vaccine has been donated to countries. I think today this is the 6th country that we are donating as the World Organization for Animal Health. We are donating the rabies for, to encourage countries to implement vaccination and contribute to elimination of non-related rabies by 2028. We are not saying that this vaccine is enough, but we are trying to incentivize, to catalyze countries to try and get into the habit of going out there and fighting rabies. In line with this theme of eliminated dog-related rabies, and on behalf of the OIE Director General, Dr. Monique Leroy, I have the pleasure to hand over 50,000 doses of rabies vaccine from the World Organization for Animal Health Vaccine Bank to the government of Botswana today. In addition, the OIE will provide technical support in the form of training of vaccinators on modern data capture methods using digital devices for ease of visualizing, analyzing data, and reporting the activities on rabies. So the donation is not just the donation of vaccine, there is also a capacity building component, but it's voluntary. If you don't need it, you don't have to request it, but I will advise that you do that, because I know for a long time, rabies vaccination for most countries, we are using paper-based recording. These days there are digital platforms where you record everything, and everything gets plotted in the map automatically, and like that. So final is that this is our small contribution to assist and encourage Botswana towards the elimination of dog-related rabies by 2030, as agreed by the international community, as I've already said. I thank you for that, and you are ready to donate